Welcome to the Safe Staffing Programme Bitesize video on the duties of the Health and Care Staffing Scotland Act 2019, hereafter referred to as the Act. This video is aimed at adult services. We will begin by looking at the duties for the Care Inspectorate. Chapter 3A of the Act states that the Care Inspectorate has responsibility to develop staffing methods in care homes for adults and such other care services as the Scottish Ministers may by regulation specify. Consider multidisciplinary staffing tools, review and develop staffing methods if that recommendation is supported, collaborate with a wide range of stakeholders and social care sector representatives in developing the staffing methods, as well as having regard to the guiding principles of the Act and any guidance provided by the Scottish Ministers. Scottish Ministers have a duty to consult with stakeholders prior to issuing guidance related to the duties of the Act. This should include any relevant reviews, reports and information. The Act states that Scottish Ministers must compile an annually published report setting out a summary on how duties are being undertaken by those who provide, plan and secure care services, the effect that staffing levels in care services have on the ability to complete these duties, the steps Ministers have taken to support staffing levels in order to assist in this, how these matters will be taken into account on determining the future supply of registered nurses, medical practitioners and other care professionals, and the steps Ministers have taken to ensure funding is available to any person who provides a care service in order to assist them to complete their duties. The report will be to the financial year of April to March. The first report will be end of April 2025. When planning or securing the provision of a service from another person under contract, agreement or other arrangements, local and integration authorities must have regard to the guiding principles, any guidance issued by Scottish Ministers, the duties relating to staffing for care service providers, and annually publish steps they have taken to comply with these duties, identifying any risks that have prevented them from complying. These are the sections of the Health and Care Staffing Scotland Act that apply to care services. The guiding principles, the duty to have appropriate staffing, to have staff suitably trained and qualified for their role. Services need to have regard to any guidance from the Scottish Ministers, and this is referring to the statutory guidance that accompanies the Act. Section 12 is about staffing methods and may apply to specific services which will be determined by Scottish Ministers. For further information, please refer to the appropriate bite-size video. There are further bite-size videos available on our hub page. Thank you for listening.